Hello, I'm Dr. Praveen Ravishankaran, a robotic cancer surgeon specializing in advanced minimally invasive cancer care. Every day, I deal with one of the most feared diagnoses in medicine, cancer. But today, we are going to talk about something very specific and more important, lung cancer. And I promise you by the end of this video, you will not only understand lung cancer better, but also how modern medicine, especially robotic surgery, is transforming outcomes in lung cancer. Now let's see an interesting experiment. Here we mix vinegar and baking soda and move the glass slowly over the burning candles. The candle goes off without even having to touch it. This simple experiment actually explains something critical about how our lung functions and how disease like lung cancer silently takes over. Many of you might remember this powerful moment from Breaking Bad.
You understood what I've just said to you?
Yes. Lung cancer. Inoperable.
I'm sorry. I just need to make sure you fully understand.
Best case scenario with chemo, I'll live maybe another couple of years. It's just...
Where Walter White, a seemingly normal man, suddenly learns that he has lung cancer. He is processing the information, and that moment has changed his life forever. Many issues, especially lack of money and a good health insurance cover, races across his mind. In the hit serial, he is diagnosed with advanced lung cancer. But in real life, early detection and proper treatment can change that story completely. Lung cancer is broadly divided into two major types. Non-small cell lung cancer that accounts for up to 80 to 85% of cases, and small cell lung cancer that accounts for the rest 15 to 20% of the cases, which is more aggressive, faster growing, and often detected late. These two varieties of cancer behave very differently, so does their treatment. The most important cause for lung cancer without a doubt is smoking. But that is not the whole story. For non-small cell lung cancer, the causes include smoking, passive smoking, air pollution, occupation exposure like asbestosis, genetic mutations namely EGFR, ALK, and ROS mutations. Small cell lung cancer is almost always strongly linked to heavy smoking. But we have to realize that not everyone who smokes develops lung cancer, and not everyone who has not touched a single cigarette in their life escapes from this deadly diagnosis. So even if someone does not smoke, they are not completely risk-free. They can still develop lung cancer, unfortunately. The symptoms of lung cancer often do not appear until the disease is advanced. But a few patients may have persistent or worsening cough, coughing up blood or rust-colored phlegm, constant chest pain, unexplained weight loss, shortness of breath, wheezing, and sometimes recurrent infections like pneumonia or bronchitis. When we suspect lung cancer, we follow a structured diagnostic approach. Initially, a chest X-ray is done for initial screening. CT chest of thorax defines the lesion. PET scan evaluates the spread, and bronchoscopy or CT-guided biopsy confirms the diagnosis. The latest changes have come in the form of molecular testing, especially for non-small cell lung cancer, for targeted therapy. Diagnosis today is not just about finding cancer, it is about understanding the biology of the disease. Now comes the most important part, treatment. For non-small cell lung cancer that have been diagnosed in an early stage, surgery is the gold standard, that is removal of the tumor and the adjacent lymph nodes. This is where robotic surgery plays a major role. I will explain more about robotic surgery soon. For locally advanced lung cancer, treatment is a combination of chemotherapy, radiation, and surgery. For very advanced or metastatic lung cancer, targeted therapy, immunotherapy, or chemotherapy may be used as per the opinion of a medical oncologist. Small cell lung cancer is a very, very aggressive disease. It is divided into just two stages, that is limited stage and extensive stage. For limited stage disease, chemotherapy along with radiation is given. For extensive stage disease, chemotherapy along with immunotherapy may be given. Surgery has a very limited role here because this cancer spreads very early. Now let me talk about something I'm deeply passionate about, robotic lung cancer surgery. Using advanced robotic platform like Da Vinci system, we can perform highly precise lung resection. Now, why is this treatment form revolutionary? Robotic surgery uses smaller incisions, causes less pain, and very minimal blood loss. Patients recover very fast, get discharged very early, and return to normal activity, which is very swift. For early stage lung cancer, robotic surgery is truly a game changer. Patients who once feared surgery now walk home within a few days after surgery. Let's talk about the important aspect of lung cancer screening. It is generally recommended for seemingly healthy people who have been smokers who are between the age group of 50 to 80 years. They may be current smokers or have quit within the past 15 years and have a 20 plus pack year history. For them, an annual low-dose CT scan of the chest should be taken to detect small, early-stage tumors, improving their chance of cure. Again, it is important to note that lung cancer is a very, very difficult disease to treat, as most are diagnosed at a very late stage. Screening is the only mechanism where seemingly normal, healthy smokers have a chance at cure by diagnosing the disease at an early stage. Now, coming back to our experiment. When baking soda reacts with vinegar, it produces carbon dioxide. Carbon dioxide is heavier than oxygen, so it settles down and displaces oxygen, putting out the flames. Similarly, in lung diseases including cancer, normal oxygen exchange is disrupted. Your body silently struggles, and the flames of youthful life and exuberance is completely put out, long before symptoms appear. Lung cancer does not always announce itself loudly. Sometimes it grows silently, just like that invisible gas. But here's the truth. If detected early, lung cancer is treatable and in many cases curable. So don't ignore persistent cough, don't ignore weight loss, don't ignore breathlessness. Get evaluated early. If you have found this video useful, subscribe to the channel, share it with someone who needs it, and stay tuned because in the next video I will break down another crucial topic in cancer care. This is Dr. Praveen Ravishankaran, helping you fight cancer with knowledge, clarity, and hope. Thank you and have a great day ahead.